What's up, you guys? It's your girl Nickilicious Nicky, and welcome to my channel. Are you one of those people who's afraid to take the vaccine? Why is it that so many people are afraid of taking the COVID-19 immunization when history has shown that diseases have been eradicated by immunization? Smallpox vaccine in 1798, diphtheria vaccine in 1926 have allowed for us to not even see some of these diseases in our lifetime. My name is Nicky and I'm a grave disease patient who took the vaccine. And this is why I took it and why I believe that you should do the same. What is herd immunity? Herd immunity occurs in a large community. The herd becomes immune to a disease. As a result, guys, the whole community becomes protected, not just those who are immune. In order to get your full herd immunity and return back to normal life, you must take your 2 shots of the vaccine to be fully immunized by 2 weeks after. Returning to normal life is the #1 reason why you and I should be immunized. Guys, this week I did the unthinkable.
I know I ain't crazy.
I went and took the vaccine.
Why? The
reaction that I got when people found out that I took the vaccine was like, what did she do?
Oh my God!
And so, guys, I didn't say anything at the time, but I'm breaking my silence today, guys, and I'm letting you know why I decided to take the vaccine and why I think that you should do the same. Missy Elliot, Wendy Williams, and myself suffer from Graves' disease, which is an autoimmune disease that results in an overproduction of the thyroid hormones, leaving an imbalance with symptoms which ranges from heart palpitation, eye disease, a fat neck, weight fluctuation, and so much more. High-risk persons like myself, my doctor advises, are given an extra layer of protection by being vaccinated because this reduces our risk of death and hospitalization if we should contract the coronavirus. COVID-19 can result in severe illness and death, particularly for persons who are in high-risk groups, as I mentioned that I am. The severity of the impact varies, and you must know that 20 to 30% of people are asymptomatic, which means that they do not show symptoms. However, 80% of people are symptomatic, and their symptoms can be mild to severe. And some of the severe conditions: severe pneumonia, respiratory distress, septic shock, cardiac disease, pulmonary embolism, and so much more. The longer term consequences can range from psychiatric complications, stroke, delirium, anxiety, depression, damage or inflammation of the brain, and sleep disturbance. As of May 2021, there are 400,000 cases and 3,600 deaths in India from the coronavirus. Bodies are being burnt on site, and the death rates are due to no medical attention. Vaccination is therefore a must, guys. And so, why is it important to be vaccinated, guys? It doesn't prevent you from catching the virus. No. But what does it do? It allows you to be 70% protected. As with the case with the AstraZeneca, you're 70% protected from the virus after 2 weeks of your first dose. And then, guys, if it will prevent you from being hospitalized or even having those severe symptoms. For sure, the long-term effects, the even temporary effects of COVID-19 are so disastrous, guys. I would never want to have that. And so for me to protect myself from it, I had to get that vaccination. And do you know, guys, that after my 8 to 12 weeks, which is the next time in which I'd get my second dose, then 2 weeks after that, my immunity would have been in such a way that I can travel without having to take the COVID-19 test. I can have, normal activity resume. normal activity incrementally. Guys, I live in Jamaica. I have to travel. I have to see my parents who are of a particular age. I have to take the vaccine so that I can resume my normal life. Now, when I got the vaccine, the AstraZeneca, the one that people associate with the blood clots, that same one, I got this lovely sign here. And of course, I got this lovely pamphlet, probably can't see it, and it tells you all of the symptoms when you take the vaccine that you should look out for. And so guys, possible side effects following vaccination: pain, redness, itching or swelling at the injection site, joint or muscle pain, headache, fever and or fatigue. Other less common side effects: dizziness, decreased appetite, abdominal pain, and large lymph nodes in the armpit or neck. On the side of the vaccination, on the side that the vaccination is administered, and or excessive sweating, itching skin or rash. Now luckily they didn't give me this before the vaccine because I'll be like, hell to the no. Of all those side effects that they mentioned, the only side effect that I experienced, and this is 4 days later, is the day when I didn't take the Panadol, because before I took the vaccine I took my Panadol. So when I got the vaccine I felt nothing. I maybe felt a little tingling in my fingertips, but that was it. And I was perfectly fine. The next day when I decided to play hero and didn't take the Panadol, that's when I started to feel the chills, and that was just like fever chills. Once I took the Panadol, once I got home from work, I was back to normal. I exercised the next day as regular, and I did everything in my regular routine, guys. So all this myth and even some of these side effects that they spoke of, I personally never experienced. 1.13 billion doses of vaccine have been administered worldwide. New data says that 94% of persons 65 years and older will be less likely to be hospitalized with COVID-19 symptoms than their same peers who are not vaccinated. So guys, it makes perfect sense to get vaccinated. As you can see by my injection site that I had no bruising, no swelling, and everything is fine. By 1923, Alexander Glennie perfected a method to inactivate the tetanus, and by 1926 a vaccine against diphtheria came about. Now guys, diphtheria is something that I've never experienced in my lifetime, and I'm a woman of a particular age. And so guys, if those vaccines were so useful in eliminating those conditions that I haven't seen them in my lifetime, I believe that the same will be true for this coronavirus. And so guys, the only way that we can get back to normal life, not wearing those stuffy masks and just being free to breathe fresh air again and not worry about transmitting a disease that could kill people to our loved ones, the only way that we could get back to normal, guys, is to be vaccinated. I'm very happy with my decision to take it, and I can't wait for the second dose. I can't wait for the 2 weeks after to be fully immunized and to start moving along. And guys, the quicker we all get vaccinated, we can move on to regular life. So guys, thanks for watching. This is a quick video. If you haven't subscribed yet, guys, hit that notification bell, hit that subscription bell. Be a part of the family. Welcome to the family. Until next time, guys.